If you're enrolling in Medicare and someone offers you a critical illness policy or a cancer policy in the same breath, please slow down. These plans are not Medicare plans. They are not regulated in the same way, and the fine print matters a lot. I'm Emily with the Medicare Coach, an independent Medicare advocate. And today I'm going to make sure you know exactly what to ask before you ever sign up on the dotted line for one of these critical illness or cancer policies. So here's the thing. I'm seeing a tactic being used by more and more insurance people trying to encourage people to buy either a critical illness or a cancer policy as they approach Medicare. Now, there's reasons for them to do it. I'm not going to go into that in here. But my point is, I want you to understand, why are they recommending a critical illness or a cancer policy? How does Medicare cover or not cover those things? And again, at the end of the day, what makes the most sense for your situation? So, what does Medicare cover? Medicare covers medically necessary services that have been approved by providers who accept Medicare plans. So, I had a client who had very aggressive cancer. Medicare covered all of his chemo, all of his tests, all of his procedures, all of his everything, because they were medically necessary, and his provider took Medicare, okay? So for most of you, when you have something like a cancer or a critical health situation, Medicare almost always covers those expenses as long as, again, they are medically necessary and approved by a medical provider. Now, critical illness policies can make sense for some people in some cases, but there's a big caveat. I'm going to talk about it here as well. I had another family friend who had aggressive cancer, and he wanted to go to a place called Euromed. And Euromed uses this cancer treatment, at the time was not approved by the FDA. It was a situation where they basically manage your blood sugar in order to administer all the chemo to you. So my point is this. He went to a place that Medicare did not actually approve to be used for his cancer treatment. So in his case, a critical illness policy could have been helpful or a cancer policy in that matter, because when he was diagnosed with cancer, that plan would give him a lump sum of money to help cover medical expenses not covered by his insurance plan, not covered by his Medicare plan. So a critical illness policy technically could be beneficial if you want to go somewhere and the FDA has not approved that treatment and you want to have a policy to help cover those expenses. Or you want to go to a place like MD Anderson, Mayo Clinic, anywhere across the country, and you need help paying those travel expenses, those hotel costs. Critical illness or cancer policies could help with those extra non-Medicare services. So there are times where someone could absolutely justify a critical illness or cancer policy to go alongside your Medicare coverage in two main situations, right? Uncovered non-FDA services or non-covered doctor services, or two, extra costs that come along with, say, traveling to a destination for your healthcare costs. So you could technically argue that there's benefit in these plans. But my one note of warning is this. Many of these critical illness and cancer policies oftentimes significantly reduce the payout once you're 65. So maybe a $500,000 payout before 65 is now only $250,000. So my question to you is, because of the payout decrease on most of these critical illness and cancer policies, I recommend that you actually ask yourself, does this make sense or not? Now, as you approach Medicare, you can absolutely make a Medicare decision, okay? But critical illness and cancer have nothing really to do with the Medicare process. So if you're getting sold both Medicare, critical illness, and cancer, please pause. Make one decision at a time so you understand what you're looking at, because they are all different and don't necessarily overlap. But again, just because the insurance person must have a higher commission on you, it does not mean you have to sign up for all of these plans as well. So Medicare will cover medically necessary services by approved doctors. Cancer policies will usually pay a lump sum of money once you have a cancer diagnosis, and you can use that money however you want. Critical illness policies usually cover cancer, but also other things as well based on your plan. So if you were to have other things happen to you, a critical illness policy could step in to help provide you finances, help you provide money to cover costs that Medicare does not cover. My thing, though, at the end of the day, is get the right Medicare plan from the very beginning. If a person is telling you to get a critical illness policy or a cancer policy because they're recommending a Medicare Advantage plan with a high out-of-pocket cost, that's a big red flag. Maybe you should not be getting on a Medicare Advantage plan with that high out-of-pocket cost. Maybe there are better options. There are usually better options. So be thoughtful, be thorough. But again, critical illness, cancer should not be muddled up with Medicare. Get Medicare right the first time, and then ask yourself, okay, based on my best Medicare decision, do these other plans make sense as well? So make sure you follow for more inside tips to help you easily make your right Medicare decision.